So, I'm 2 weeks into my contract, halfway through, and my company wants me to do a physical and a drug screen, which normally they do that prior to you starting work, but because I got here so quickly, this was the time that I could do it. So, I just thought I'd share my experience as a patient. So I'm not quite sure, since I've only been to 2 facilities here in New York, the one I'm working at, and now this urgent care. That was the worst experience I have ever had, or one of. The doctor, they called her a doctor. I didn't see if she was truly an MD or a DO or an NP or a PA. I don't know which, because she had no badge on her to show what she was, and she proceeded to do an exam on me that I'm not quite sure she was a physician. The way she was touching me, I could swear that she just saw a physical assessment on a YouTube video just prior to coming into my room. I'm pretty sure she was shaking the entire time, like she was nervous, and just didn't know how to assess me. And then I had to get my blood drawn, because they wanted to see if I had TB, which is fine. The little, I say little because she was very young, maybe 19, came to do my blood draw. And those of you that know me, first of all, know that I have huge veins in the crook of my arm. It's called your AC and a cubital. Huge. I mean, you can see him from across the room and throw a dart at him. And this little phlebotomist, or whatever she was, proceeded to touch my veins multiple times and said, I don't know that I could get these because of how heavily tatted I am. Because she couldn't see my veins through my tattoos. Again, anybody that knows me, you can absolutely see my veins through my tattoos. She poked me twice. The second time that she poked me, she did not wipe it, and I told her to wipe it again because she had touched me with her dirty gloves, because she did not change her gloves before coming into the room. She had had them on when she came into the room and did not put any gel on them. So I don't know if they were clean. My hair looks shitty today. Anyways, she was offended that I had asked her to do that. And anyway, she missed my huge vein. So then she proceeded to go outside of the room and ask for help. So she brought in 2 of her little minions with her. Again, probably in their 18, 19 years old, maybe older, but still young. I don't really like my hair today. Anyways, and they both, the 2 new ones, proceeded to touch my veins and saw how bouncy they were. They asked me if I wanted water. I'm not dehydrated. So then they said, well, maybe we should get the doctor to do this. Okay. So they proceeded to go bring the doctor back into the room. She then also touched my veins and proceeded to tell me how it was going to be difficult because I have tattoos. She poked me twice, finally got it the second time, and had a hard time getting blood out of me. But that's because she jiggled the needle multiple times, so I'm pretty sure she punctured right through it. The entire time I'm trying to keep my mouth shut and not get incredibly angry at the fact that they missed multiple times. And then I do the drug screen. And I've had multiple drug screens because I've worked at multiple hospitals for multiple people, multiple organizations. Even that was a little strange. The lady took my blood and went back to the room with it without me. So I thought that was really odd because normally they're supposed to do that all in front of you. So by the time I washed my hands, no soap in the bathroom. So I had to rewash them again in the exam room. She had already had my urine in another cup, which is usually what they do, and was filling out the paperwork. So I'm not sure if it's my urine because I didn't see her put it there. And then she, they label it with you being there, and she was ready to label it without me being there. And I said, I'm pretty sure I'm supposed to watch you label that blood and then put it in the specimen bag and seal it in front of me. So she goes, oh, that's right. I really hope that the rest of these places here in New York are not like this. I'm appalled at this urgent care's lack of experience, lack of knowledge, lack of expertise, lack of professionalism. Just because somebody is tatted does not mean that you have an issue with getting veins. I get veins on people that have tattoos that are dark skinned all the time. You don't have to see a vein, you can feel it and get it without a problem. I do it every day with 2 gloves on all the time. I'm nauseous now because of thinking how these people have treated me. They didn't change their gloves when they came into the room, and they didn't gel on the gloves that they had on. I don't know the patients that they have touched, and now they've touched me. This is not the type of medicine that I have ever practiced, nor have I seen until now. And this was at an urgent care. These people are touching other people. Pretty sure they're spreading germs, and they're healthcare workers. I want to run so fast from here and never come back. I feel really sad for these people here, for these 2 places that I'm at or have been at. I can't wait to go home. This is appalling. Appalling. And then when I asked the lady to clean my vein off again, and then she brought in her little friends, and I said, my veins aren't that hard to get to. She said, there's no need to talk to me like that. Okay. Trying to keep all that in and not tell her to go fuck herself. And this is what these people that live here get? This shitty fucking care?